Let's talk about both hypo and hyper responders to GLP-1 agonists. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician, and many of my patients are prescribed GLP-1 medications. And because I do this all day, every day, I can clearly see that everybody has their own unique response to these medications. If you are only talking to, one friend or family member or coworker, or are reading stories online, you are typically either just hearing one person's story, or if you're looking on social media, you often see the highlights, and typically that's the hyper responders to these medications. But the reality is everybody's experience is so unique, and there are people who do very well at lower doses, and some people who do not respond until we get to the higher doses. Some people's journey is longer until they hit their goals. Others achieve it faster than we would expect. So I wanted to talk about why that might be the case. So first of all, we all have different genetics, biology, environmental factors, lifestyle, jobs, routine, baseline movement. We have different medical conditions and medications that we're taking. Our sleep is different. Stress levels are different. You can see here that there are already so many factors that are playing a role in somebody's weight maintenance and how they're going to respond to various treatments. And that does not mean that one is, better than the other. It just is the reality that we live in, and we do have to take that into account. I do share with my patients what studies show for the most common GLP-1 medications that I use, which is Zepbound and Wegovy, because I'm mostly treating obesity or overweight, although I definitely treat other medical conditions and metabolic diseases, but those are the main two. And for Zepbound, on average, we see about 20% total body weight loss, and it's important to know that this is over the course of a year or more. Some people hear that and they expect that the weight loss is going to happen in the next couple of months, but we're looking at the course of at least a time or a year is the time frame that we're looking at. And that's okay, because we're looking for longevity and long-term health outcomes. At least that's what I do in my role as an obesity physician. For Wegovy, on average, we see about 15% total body weight loss over the course of a year or more. And it's important to know that these are averages. So I have patients who lose much more than that for both of the medications, for Zepbound and Wegovy, and I have patients that lose much less. And what we see in clinical practice and in studies is that there are patients who are just actually non-responders to GLP-1 medications, meaning that despite taking the medication regularly and following the guidance of their provider and changing their diet and nutrition and their physical activity, they lose less than 5% of their body weight during that study period. The medication is just not the right fit for them. There's another reason that they are carrying excess weight that needs to be addressed. And this is why working with a board-certified obesity physician is so important, because it's not just prescribe this medication and everyone's going to have success. There are many more nuances to the treatment of obesity. When we're looking at the speed of weight loss, healthy weight loss is when we're losing about 0.5 pound to 2 pounds on average per week. So that's what I'm calculating when I'm seeing patients for follow-up. Most people do fall within this range, but there are people who are losing a little bit slower or faster, and those are more of the hypo-responders or the hyper-responders. And I want to first talk about the hyper responders, because these are the people that usually are following up and are very, very excited about the change that they've seen on the scale. What I sometimes see is a 10-pound or more weight loss in the first month. But as their physician, that makes me a little worried. And the reason being is that there can be a lot of complications that can arise with rapid weight loss. So again, that would be more than on average 2 pounds per week for most people. The complications of rapid weight loss can include gallstone development and complications from that. So, pain in the right upper quadrant where your gallbladder is, that could be, clog or your gallstones clogging the duct that can cause pain, and eventually could lead to an infection, which can be very serious. You can also develop dehydration, which could lead to complications, specifically damaging the kidneys. It could also lead to fatigue and headache. We can also see, just stress on the body that can lead to hair loss down the line. Typically about 3 months after the rapid weight loss, we'll see shedding of the hair. If somebody is not getting enough nutrients in because they're too appetite suppressed, we could see nutritional deficiencies, low iron, B12, B1, vitamin D, and other nutritional deficiencies. We can see macronutrient deficiencies, which can often lead to a loss of muscle mass or just general fatigue. Maybe they're not getting enough fiber in, so constipation is a major issue. If they're losing weight because of negative side effects, then that could be nausea and vomiting and just poor intake or loose stools and diarrhea. That is not health. That is not what we are shooting for when we are treating obesity with GLP-1 medications. And so I screen for all of those complications and make sure that that's not happening and watch for the development of that over time. But if somebody is losing more than 2 pounds per week, then we do need to slow down the pace. And that can be disheartening for some patients, but my job is to, keep health and safety at front of line. So that is my goal. And so we, like I said, need to just slow things down, and that's okay. There's no rush. You're already ahead of the curve here. And it does not mean that we can never increase your dose. We just need to make sure that we are adjusting the prescription in a way that is safe for you. I'll also say that some people, especially if they're carrying a lot of inflammation, may lose significant water weight in the beginning, and that can look like a big drop on the scale, and that tends to slow down over time. So I do see that quite often for these hyper-responders, especially in that first month. If they lose a lot, then that does often slow down in the second month. But when the prescription is adjusted thoughtfully, like I do in my practice, Missouri Metabolic Health, I often do not have to increase patients all the way to the max dose. The goal is to find the dose that's effective for you, where your appetite is controlled, your food noise is controlled, you're feeling full with adequate portions, and you're not having many or any side effects, and you're meeting your nutrition goals. That's a perfect dose. So that may be the starting dose at 2.5 milligrams for Zepbound, or it could be 5 milligrams or 7.5. That's okay. You don't have to get to the max dose to get your max benefit. We want to find the dose that is right for you. And then to our hypo-responders. I do have some patients who, at their first follow-up, when they are at the starting dose for 4 weeks, they'll come back and sometimes they tell me it doesn't feel like they're taking any medication. And that can be very disheartening. But I am always very positive when this is happening because I know that this is only the starting dose. So again, for Zepbound, that would be 2.5 milligrams. And we have all of the doses that increase by 2.5 all the way up to 15. And so we start for everyone at the 2.5 to make sure that we're tolerating it. And then if we are, but we're not getting those positive benefits yet, we can increase the dose. And we will continue to do so until we start to see those positive benefits, both with appetite and food noise control, as well as, changes from a metabolic health standpoint, as well as weight loss. A lot of times these hypo-responders or slow responders are the ones that have truly the best long-term health outcomes, because for the vast majority of them, they will eventually find a dose that they respond to, and they will lose weight at a slower pace, which will help to maintain their health status, their nutrition status. It's less stressful on the body. They don't have, as much hair loss. They don't have as much fatigue, or less likely to lose muscle mass or have those other complications that I mentioned that we see with rapid weight loss. So going slow is not a bad thing at all. And in fact, it can be the healthiest way to treat your obesity. And then for those non-responders or individuals who reach either the max dose or the max tolerated dose and they still have not reached their health goal, that's okay. GLP-1 medications are not our only treatment option. We can either combine the medication with another obesity management medication. I just reviewed the first generation OMMs, and I'll link that here so you can review those options. Those can be combined and can be added to GLP-1 medication. And we should never forget metabolic and bariatric surgery. This is still a great treatment option for individuals living with obesity, especially anyone who has type 2 diabetes that is difficult to control. Metabolic and bariatric surgery is a wonderful option. So I hope this talk highlights the nuances of responding to GLP-1 treatments. It is not a one-size-fits-all. You should never, be following a regimented titration schedule. If your prescriber is increasing your dose no matter what, it's okay to ask them to slow down if you're having side effects, or if your appetite is too suppressed, or you're losing weight too quickly. You have the ultimate authority of your health and your treatment. And again, the goal is to find the effective dose for you. Whether you're a hyper-responder or a hypo-responder, you have options available. And if you're not getting individualized treatment, it's okay to ask for a second opinion, whether that's another primary care doctor, an endocrinologist, or an obesity medicine physician. You deserve that individualized care that is focused on long-term health outcomes rather than just rapid weight loss and the lower number on the scale. That's not health. So I hope you found this helpful. If so, please subscribe, share with somebody who would benefit from this information, and I'll see you next week.